Good afternoon, everyone, and good morning to those of you who are in the Panhandle area. So excited to welcome you today to the celebration webinar for Mother Focused Care. I'm Lori Reeves. I'm the Executive Director for the Florida Perinatal Quality Collaborative, and I'm joined by most of our staff team today, along with many of our coaches that helped support this meeting over the last 18 month initiative over the last 18 months. So thank you so much for joining us today. There is a lot to celebrate, and I can't wait to share all of it with you. Next slide, please. Don't forget to please mute yourself so that we don't get background noise. Many of you are in hospitals, and we know that background noise can be a problem. If you have a question at any point, feel free to drop it in the chat or raise your hand, and we will address it. We don't mind stopping in between presentations or in between slide sets to answer questions if they come up. But it's always easy to drop it in the chat and we can address them that way as well. And please note this meeting is being recorded so that hospital teams that weren't able to join us today can watch the celebration webinar later. Next slide, please. Welcome to all of our Mother Focused Care hospitals. They don't all fit on one slide. There's so many. But here's the second slide. You all know who you are. And of course, the entire list is also available on the fpqc.org webpage. Next slide, please. This is from the mid-initiative meeting. We had a really great meeting 9 months ago. And we're here now. We talked about at that meeting some of the successes that had already happened with the initiative and also where some of our remaining challenges were and some strategies to kind of close the gap between that point and the end of the initiative. And I think hospitals have really stepped up to the plate on that and really done a fantastic job of closing those gaps and meeting their goals on the initiative. So I just really want to congratulate all of you. Next slide, please. I'm going to hand it off to Dr. Estefania Rubio, who is our data lead. But before I do that, I just wanted to say we have 67 hospitals in the Mother Focused Care Initiative, and that accounts for 64% of the hospitals that deliver babies in the state of Florida and 68% of all the births. So one of the things about doing a change process like quality improvement as a group that I always want to remind everyone is that you have the ability, all of you working together at the same time, to build momentum that can impact the entire state. So I want to thank you all for being willing to work with us. And I want to hand it off now to Estefania to share with you some of the fantastic outcomes over the course of the last 18 months.
Thank you, Lori. Good afternoon, everyone. Welcome. We are extremely happy to see you all. Thank you for joining. Thank you for taking the time to be with us today. As we celebrate your achievements, you've done fantastic work. You can see here our map. We had 67 hospitals join the initiative. That's 64% of maternity hospitals in the state, and that is about 68% of births. So we knew from the start we had a huge opportunity to have a huge impact on this initiative. Next slide. So we're going to go through sharing some of the data insights and milestones of the initiative, and along with that, we're going to talk about our aims and the achievements of the initiative. So let's jump into the next slide, please. We had 67 hospitals reporting data from July 2023 to December 2024. A total of 5,044 postpartum women. It's amazing. We had 23% that are Spanish speaking for their preferred language, which truly reflects our Florida population, and 64% with Medicaid cover. We know that 10% didn't have any prenatal care, 10% we didn't know if they had or not prenatal care, and about 3% we had unknown ethnicity. So we know that for ethnicity and race, we usually have a little higher percent, and we started higher, so it's really great to see that percent dropped throughout time in the initiative. You can also see the distribution by race ethnicity. We have the non-Hispanic white, where 32%, Hispanic 33%, and non-Hispanic Black 31%. Given that we were focusing on the population that is affected by SDOH, we know that that's also true for our population. Next slide. So for our aims, we wanted that by December 2024, and it has come, we would achieve two very important things. The first one, a 20% increase from baseline in the percent of patients with a positive SDOH screen who were referred to appropriate services. And we also wanted to get at least 80% of providers and nurses attending a respectful maternity care training since January 2023. And we are going to look at results. And let me see, I'm going to cover the next couple of slides. Next one, please. So we know that the CMS requirement is that we screen for social determinants of health, especially those 5 tenets that are so important, right? And so our first thought was we're going to work with you all as you build that system so you can have universal screening at your facilities. And Margie always proudly says that we led our way. The OB, L&D department really took this on and was a model unit for many places in the hospitals. So kudos to all of you that worked on this even before it was required in 2023 when it was voluntary. You were already doing it and building the capacity for your facilities to do this well. And so you can see the progression, and these box plots, I love them because they show the distribution by hospital. So we know that we have 67 hospitals in the state. At the beginning in 2023, Q3, you can see that that box is very, very wide, meaning that we had hospitals all over the place, right? But towards the end of the project, you see that that box is now narrow and it's close to 100%, meaning that most of our hospitals are screening well, and for the majority, if not all 100% of patients. So kudos to all of you. That's a huge, huge improvement. Next slide. So we know that screening was a CMS requirement, but we went that step extra, that step farther that we needed to go for patients, right? It was not only about screening and documenting the screening, it was about referring them to appropriate services, depending on what they screen, making sure they had the resources to cover their needs. And that went from 48% at the beginning of the project to 77% in this last quarter. So again, a huge increase, a 60% increase that really reflects a huge commitment by your teams, because we know that these required a lot of coordination and communication with community services and increasing those funds so you could take care of your patients. So kudos to all of you, that's just fantastic. Next slide. This one is telling you something similar. So the previous one was the percent of patients, this one is by hospital. So again, you see at the beginning this wide distribution, right, where hospitals were all over the place for referring patients to appropriate services. And towards the end, now we have less variation. The majority of hospitals are doing this well for the majority of patients. So again, a 60% increase for this one when we were hoping for a 20%. So again, huge, huge kudos to all of you. Great, great improvement and achievement. Next slide. So for this one, I'm going to ask one of our clinical colleagues, Jessica Brownlee, to take on the conversation and lead us on it. Jessica.
Thank you, Stephanie. One of our aims was to have 80% of providers and nurses attend an RMC training and commit to respectful care practices since the beginning of the initiative. And everyone who engaged in this knows just what a daunting task it can be to get all of your staff, or nearly all of your staff and providers, to attend a training, especially during this time where everyone is so busy. But you can see here that over 80% of nurses were trained in respectful maternity care practices, and just over 65% of physicians were able to be trained. Although the physician number didn't meet our goal, I can say this is truly a Herculean task to get to get physicians engaged in this work. And so really, really applaudable, I think, to get that many people engaged in these trainings. Next slide. Yeah. Okay. So not going to read all of this, but I think what's really important for us to recognize was that when we started this, we knew that this was going to be the foundation for all future work that we do at FPQC. Respectful care is a universal component of every driver and activity, and we understand that it's one of our core values and will be included in all of the work that we do moving forward. And so thinking about all of the processes, all of the resources that we've been put in place is going to help provide the foundation for all of the other initiatives that we participate in moving forward. Thank you.
Thank you so much, Jessica, for that. We appreciate you. So next, I just want to go over our hospital level structural and process measures. You guys will remember answering about these on your hospital level data entries. And so I want to go over how we've improved from baseline, which was Q3 of last year, to now Q4 of this year. So process mapping for collecting demographic questions, we started out at 10%, we finished out at 82%, which is fantastic. And then process to collect and correct patient self-reported demographics and SDOH increased from 18% to 81%. Strategies to answer patient questions about demographic and SDOH data. Similar to the other two above, we started out at 6% and then finished out at 70%. And then of those hospitals that implemented a policy, protocol, or guidelines for referring patient to appropriate services, we started out at 12% and then we finished up at 75%. Next slide, please. All right. And then a strategy for sharing respectful care for patients and providers. We started out at 0% and we ended up at 60% overall by the end. With the respectful care survey, we ended up with 69% of MFC participating hospitals implementing that survey. Got some really awesome results. I'm sure that they've shared with all their patients that we'll get back to in a second. And then implement written action plan to address health disparity. This one was tricky. We started out at 1%, but we got up to 58% from hospitals utilizing their PQI information and coming up with those plans. And then lastly, the QI team and leadership educated on the importance of family and community advisors. Started out at 1% and increased to 19%. And speaking of family advisors and community advisors, I'm going to hand it over to our family advisor, Mandy Gross. And before she speaks, though, I want to go over these numbers here. So we started out at 1% and we ended up at 19% for hospitals incorporating a family advisor. So not as high as we'd like to see, but with Mandy's help and other hospitals that have implemented this, we want to continue to share strategies and the importance of these crucial members of our QI team. And then lastly, the community advisor, we started off at 7%. And we ended up at 45% thanks to the help of our partnership with the Healthy Start Coalition. But we'll go over that in just a second. So Mandy, take it away.
Hi, everyone. I'm so happy you're here, part of Mother Focused Care, and interested in including patient family advisors. As one of those, this is very close to my heart. And as we move into the Prompt Initiative, we have lots of great resources and education materials. So all of you can access that on the FPQC website. We have great toolkits and toolboxes if you're still interested in making this happen. I'm here for you if you have any questions or you'd like me to speak to your hospital or help you find someone who you'd like to speak. I'm here for all of it. Thank you all for being here, and I'm happy to answer any questions that you have.
Hi, my name is Jonna Johnson. I am the communications manager at Healthy Start Coalition. I am the family advisor to this project, MFC project. I did a lot of the initial focus group work. We started with 14 women, but the group consistently had 12 women on focus group calls. They just delivered within the year of the project launch date. So that was one of the main criteria, and they were across the state. So they weren't focused just in Tampa, they were in Orlando, Polk County, et cetera. The focus group shared their personal experiences, not only at the launch event where we had 3 moms share their stories, but they also focused on the contents of the toolbox in which you use currently. So everything from the definition of respectful maternity care as made by the team leads who you received your training, to the revised logo, because we underwent a few changes, to the language in the survey, how to better word some things or help moms understand the language, and a lot of the other materials used, all up into the postpartum survey that they received. So that was a lot of the fun work that we did. A lot of the things that you see are reflected and come from the valued opinion of the women who just stayed at the hospitals in which you work. And it was a lot of fun to do. I think we had 8 sessions overall, and then 10 total opportunities for feedback throughout the entire project.
Thank you, Jonna. And I just want to jump in for a moment because I really feel like I need to give Jonna a special shout out as our family lead for Mother Focused Care, because she really worked very, very hard to recruit that large group of women to get their no holds barred sometimes reactions to some of the content and materials that we wanted to share with you as hospitals that you could work with, that you could share with your family. So I just want to make sure I acknowledge that work. And I also want to go back to what Mandy was saying a moment ago about the opportunity to have a family member engaged in your quality improvement team. If you haven't managed to pull it off yet, we understand it isn't an easy thing to do. You've got to go through a lot of internal administrative challenges at a hospital in order to make it work. But we're going to keep asking. And so that's something we at the FPQC feel very strongly about. The evidence in quality improvement science shows that having families fully engaged in your quality improvement work will help you be more successful. So we're going to keep providing those opportunities. We're going to keep providing those resources because we feel it is very important. And you can see that because we always bring families to the table ourselves. So with that, I'm sorry for interrupting, but whoever's next after Jonna, go for it.
Thank you, Lori. Yeah, that is a very vital and critical reminder. They were critical in every step of developing the initiative, in bringing together the packets, making sure that we have the patient voices that we needed, making sure that we took into account those experiences that are so important as we build those packets. So thank you all for that. And yeah, we will continue to track it. So you'll see it if you're participating in prompt. It will be one of our measures as well. The next thing we are going to cover is the Respectful Maternity Care Survey. We had 47 hospitals doing it and implementing it at different levels. And this is the survey where parents or moms gave us their feedback about their experiences during their hospital stay. There were a set of questions that have been revised by many states now. And the responses were quite interesting, and those reports that came to your hospital, those open-ended comments, are truly where the most value of the survey is at. And so we have follow up with some of you to understand what is happening after those comments are received. And we really hope that you continue to do that as you receive those patient reported experiences through surveys or through direct communication, that you continue to incorporate their feedback into your care. But for our survey, we had 3,822 responses through October. You can see that most of them were responded in English. 83% of the responses were in English, 12% were in Spanish. We had some Haitian Creole patients responding to the survey as well. We had 4.6%, which is great to see. And then by race ethnicity, we have about the same distribution that we had for our COH initiative. So you see 38% non-Hispanic whites, Hispanics were 35%, Blacks 18%, and then other races 7%. Next slide, please. One of the most interesting questions was this one. When patients reported that they felt pressured into unwanted or unclear care. So 6% of patients reported that. For the other questions, we had very high rankings. This was the only one that about 6% of patients responded that they felt pressure into unwanted or unclear care. And when we looked at differences by race and ethnicity, that's the one that had the most disparities. So we saw that 9% of our non-Hispanic Black patients responded that as being true for themselves, in comparison to 3% for Hispanics and 5% for non-Hispanic whites. And so just wanted to bring this one to your attention. We still have disparities even in the perception of care. And so we need to continue to track this and make sure that we have systems in place to go against this kind of thing, right? We want to provide respectful care to our patients, and we want the care to be perceived as such. Next slide. For the other type of feedback that we found on the surveys, patients that responded having issues during their hospital stay, they felt dismissed or intimidated, felt that they had aggressive or pushy approach by specific persons in the care team, had some communication gaps and some privacy concerns, like they felt interrupted while breastfeeding, where the team member didn't knock when they came in. The next slide, please. They also referred that they received insufficient guidance on baby care for moms that didn't have enough support around them, that they lack a little bit additional support for dads, like a more comfortable place to stay, and maybe food options, that there were dietary options that were limited, some nurses that were inexperienced, having struggles with IV placement, equipment organization, such things, and some limited access to alternative pain management, or feeling neglected after the birth when the attention shifted to the baby or mom. So these may look like a lot of themes, but counting every single one of the feedback that was, I don't want to say negative, but not encouraging, giving us opportunities to improve the system. We had about 63 responses that fell into that category. So the themes that you see here only come from 63 surveys. The majority of them were overwhelmingly positive, where the team received a lot of praise, right? But I still think that these comments give a lot of food for thought of things that you can improve with your teams. And then when I was saying that your specific hospital report will give you guidance on which specific aspect may be an issue in your unit or with some team members. Next slide. So the very positive feedback that we received, which was the vast majority of surveys, again, over 99% of them, honestly, celebrated and the recognition of coordinated efforts for a smooth childhood experience. They were extremely grateful for your professionalism, your competence and compassion. They recognized the staff who tailor care to individual needs. They acknowledged the hospital's welcoming and empowering environment. And they were extremely grateful for specific nurses and doctors who really demonstrated exceptional professionalism, kindness, and expertise throughout labor delivery and postpartum care. The majority of those feedback were so encouraging, and I really hope that you were able to share with your teams, because you all do extremely hard work, and those comments can really get you through the day. I remember those days on the floor. So please, if you haven't, make sure that you share those feedback with your team as well. Celebrate those huge gains and that very respectful care that most of your patients share with you. Next slide. Okay, so this is very, text is very small. I don't intend for you to read it. These are all our secondary drivers, right? And we were focusing on improving data, improving the collection of demographic information, screening for SEOH, making referrals, making those connections with our family and community advisors, and making sure that we had a process so there could be and mutually agreed upon plan of care with shared decision making. And so this is just to say that we have hit goals for every single one of our secondary drivers. So this is just thank you for your amazing work. You can see here that the one that improved the least improved by 28%, but the majority of the measures improved by at least 60%. So amazing, amazing work. Thank you so much for all you've done. And we are looking forward to seeing your sustainability data. And we know that some hospitals will continue to improve. And so today we just wanted to say thank you and just share the amazing improvement and achievement that you have done. Next slide. All right, so we're going to wait. We're going to break for a second and open up the floor for questions. If you have any questions and you'd like to come off mute, you are welcome to, or you can put your questions in the chat. Either one is completely fine. Are there any questions at all so far? Okay, I don't see any questions, so we can move forward. Next slide.
Okay. Thank you, Estefania. And again, it's great to see so many of you on today. We so appreciate all the great work you've been doing, as well as want to also thank all the coach mentors on. And Karen Harris did want to be here as your OB, one of our clinical co-leads with Jessica and I, but I'm going to just keep going along here. So we want to talk about on the next slide, talk a little bit about sustainability and sharing your results. So this one I truly love. This comes from the IHI, and I don't know about you all, but I love my mochas, especially during this time of the season. And so think mocha for sustainability. So MOCA, the M stands for what are we going to keep measuring, but also what can we stop measuring? What is not of value? So that's the M in MOCA. O is ownership. We want accountability. Who's going to make sure that things stay on track, and how are we making sure all of our metrics are being met? Communication, we're going to talk on the next slide about how we can communicate this visually. Just your whole communication plan is the C in MOCA. Then H for hardwiring the process. You want to make it easy. You've standardized your process for screening and referrals, as well as new hires orientation to RMC, but hardwire that process to make it easy. And last but not least is assessment of ongoing success. So we want to make sure, how are we making sure that we're sustaining our gains, continuing to maybe do some PDSA cycles if you see you're slipping up on something. And if you want more information on MOCA, you can go to the IHI website, and the link is right there at ihi.org. And next slide. So here are some examples of how we can communicate. I won't go into great depth on this because we did cover this at a coaching call, but this is the one pager. So people may wonder, what did you do with the MFC? Well, this is a nice one pager front back from FPQC on the Whole Mother Focused Care Initiative and the outcomes. And Shelby, on the next slide, Shelby, I'll tell you, she's amazing when it comes to this next worksheet you're going to see. An impact statement. So the impact statement, again, coaching call, we covered this. This is how you can get the results out, individualized for you and your hospital on what you did great. Let the C-suite know, let the leadership, and let those frontline people know what it is you achieved. Now, I do want to tell you, somebody on the call, I think it was UF Jacksonville, did a beautiful impact statement, but Shelby will share with you exactly what it will look like. And this is just an example of the template. And so with that, that's the health impact statement example. And next slide, we will go up to, we're going to be handing it off to Lori to go over the stars and any questions you have.
Okay, anybody have any questions about sustainability before we get to the stars? I mean, I know you all really want to see the stars, so, but we do have time for a question. Any questions? Any hands raised? All right, let's go to the next slide, please. So, as you all know, we award stars to hospitals for specific achievement on different metrics. And we establish these at the beginning of each quality improvement initiative so that you know throughout the initiative what you need to achieve in order to qualify for a star for that metric. For mother-focused care, our stars were around meeting participation, data collection and reporting, hospital capacity, referral to services, and respectful maternal care training. So let's go to the next slide and we will share some information about who has achieved each of these stars. Okay, meeting participation. In order to qualify for this star, you had to participate. Your hospital had to have at least 80% active participation, which included attendance at monthly coaching calls, attendance at the mid-initiative meeting, and at periodic webinars, as well as doing a quarterly presentation of an applied quality improvement tool related to mother-focused care in your coaching calls. So let's go to the next slide. Here are the hospitals that have achieved this metric. We have 42 of our 67 hospitals achieve the star for meeting participation. And it's hard to do a drum roll virtually, but congratulations to all of you. This required a lot of commitment over a long period of time. We know that you have many competing obligations that made it difficult sometimes to attend the meetings and be on the calls. So huge shout out to all of you for meeting these goals. Next slide, please. Okay, star number 2, data collection and reporting. This one is hard. We acknowledge that it's hard. It's hard to track your data. It's hard to remember to submit it and have time to submit it. But in order to qualify for a star in data collection and reporting, you had to complete submission of your monthly and your quarterly data with no more than a 1/4 lag at any point during the initiative. And also you had to implement a strategy to share your data. So you had to either do an impact statement, share your QI progress in OBGYN meetings or grand rounds, post your data internally, et cetera, some mechanism for sharing your data with your team. So you can see it's a challenging one to meet. Let's look at the hospitals that achieved this star. So again, drum roll, 26 hospitals got the star for data collection and reporting. And that's not quite half. And I think that demonstrates to you that it's not an easy thing to do. We know quality improvement is not an easy thing to do, but your successes have been incredible. And we want to congratulate those hospitals that were able to achieve this star. Next slide, please. Okay. The next star is for hospital capacity, and hospital capacity really refers to implementing specific structural measures that improve your capacity to provide the specific care that we're working on in our initiative. And so for this one, you had to achieve at least 6 of the structural measures. And you can see we have a lot more than 6, ranging from engaging a community or family advisor, implementing protocols for referring patients to community resources, having a written hospital action plan to address an issue of disparities related to health-related social needs, et cetera. So your hospital had to achieve 6 of the total. And let's look at the hospitals that achieved this star. So we had 52 of you achieve this star. And I think that by that star makes me feel really good about the sustainability possibilities for this beyond the end of the active phase. The majority of hospitals were able to implement at least 6 of these capacity components. I think that puts you in a good place to sustain your efforts over time. And it took a lot of hard work. We acknowledge that. So congratulations to everyone for achieving the star for hospital capacity. Next slide, please. Okay, star number 4, referral to services for patients who had a positive screen for social determinants of health needs. And we measured improvement here by 20% above the baseline or surpassing your hospital's goal, and that you had to continue that improvement over the course of the initiative. So once you reached it, you had to keep it going. So let's look at who has achieved the star. You can see here, 39 hospitals achieved the star for referrals. This was hard. We know that we worked with you to provide a lot of resources to help you with the referral process. Healthy Start was a huge component of that. It was not an easy lift. We acknowledge this. And I applaud everyone who achieved this star for making this improvement for referrals. Next slide, please. Our final star is for provider and nurse respectful maternity care training. And we talked about this a little earlier and already mentioned that improvement was determined by surpassing the goal of getting at least 80% of your team trained in respectful maternity care, and that it should be sustained until the end of the initiative. And again, a difficult thing to do, and the beginning, we hope, of the framework for all of your future initiatives of incorporating respectful maternity care into all of the work you do with your mothers and families. Next slide, please. 40 of our hospitals reached this goal. And I know that it was a slow and difficult process. And many of you had to go back to your teams repeatedly to get this. We had the incredible respectful maternity care train the trainer component done by Nicole Pellegrino and Jessica Brumley that helped equip your teams to go back and do training at your facilities. Some of you use different approaches to training from different organizations. We didn't determine that you had to use any specific approach. We just recommended that you choose a model that incorporated some key metrics for respectful care training. So I think it's phenomenal that 40 hospitals achieved this. I know the rest of you continue to work on it, and I have no doubt that you're going to achieve this over the next year or so. But thank you all, and congratulations to those who achieved the star for RMC training. Next slide, please. So here's what your certificate is going to look like. And we have dropped, Shelby, thank you, in the chat, a link. Last initiative that we finished, the Postpartum Access and Continuity of Care, the PAC initiative, we asked you, the hospitals participating, if they wanted to share their star achievements with their C-suite. And many people did. And so we ended up sending letters to the CEOs, CNOs, et cetera, at 60 plus hospitals, and included a copy of their star certificate along with a list of how difficult it really is to achieve these metrics so that we could bring attention to your accomplishments, to your leadership in your facility. If you want to do that for this initiative, you go to the link that Shelby dropped in the chat and put your information in there. And we will get those out in probably about mid-February. Next slide, please. Last but not least, we have to thank our coach mentors and our lead for our coach mentors, Margie Boyer. This process of having a physician or midwife and nurse dyad supporting every single hospital on a monthly basis, I think makes an enormous difference in hospitals being prepared to achieve these goals. And without our coach mentor model, there is no way, I firmly believe there's no way that we could work with as many hospitals as we have enrolled in our initiatives and to be as successful as we are. So I want to thank our coach mentors. If you're a coach mentor, raise your hand or wave. But thank you all so much for your work. It's incredible. And we are deeply grateful. Next slide, please. Oh, and we have their names. Pat Durant and Alyssa Brown. Charmaine Andrews and Cole Greaves, Stephanie Little and Jessica Brumley, Nancy Travis and Vanessa Hux, Mignon Outlaw and Karen Harris, Rosalina Mahler and Christina Bennett Wiley, and Kylie Rollins Perez and Andrea Freil. So thank you all so very much. I know we'll see many of you again on our next maternal initiative, obstetric hemorrhage, that is going to kick off in April. Or you're already committed to coaching for the Prompt Initiative, which kicked off already in October and will begin the active phase in January. So thank you all. Next slide, please. Does anyone have any questions for any of our presenters or about any of our content before we wrap for the day? You can chat it, raise your hand.
Lori, it's Nancy Travis. I just want to say thank you to the whole team at FPQC for keeping us on track and for helping us all through this initiative, because we couldn't do it without you either. So thank you, FPQC team.
Well, thank you. We have a great team. I'm very proud of their work. And we absolutely find joy in this work, working to support you at the hospitals. I have never had a job in my entire life that was as much fun as this one. So thank you all for working with us and partnering with us. We are grateful.